Until the President signed this bill, the Zadroga bill, a few weeks ago now, we were operating on an annual basis without any authorization. Basically what that means was that after 9/11, clinics like this were open, but they were never officially authorized, if you will, by the federal government. They just basically limped along, I hate to use that term, on an annual basis with funding provided by Congress. And there was always the fear that they would be discontinued or they wouldn't have funding. And so many of the first responders got together in organizations and essentially petitioned Congress to say, look, we want this to be an authorized program that exists, for the rest of our lives, because as people get older, more of the disorders related to the World Trade Center attack come to light, and it may be more difficult for a lot of these people to petition the government because they're sicker or they're older or whatever, and we want to have a regular, permanently authorized program. And that's what, that has sufficient funding so that we don't have to come back to Congress every year and ask for money. Finally did get it passed, and what we did get passed is a 5-year authorization, so now the program is permanent in that it's an authorized program. The funding is mandatory, meaning that I think it's about $1.5 billion.
As the Congressman said, is not a bill providing insurance for many people who have insurance but still have some challenges. It is about establishing centers that specialize in this area. Congressman, thank you for thinking about this in a very forward-thinking way. And this is the kind of way that we're going to get our arms around this and really do the sorts of things that are necessary to help these folks who are really absolute heroes for us.
Thank you.
We have a lot of our patients, police officers, esophageal reflux after this. We have a number of our patients that we have found precancerous lesions that we know where to look and how to look, and we have been taking care of them, and that's what we want to continue to be able to do, and we're grateful for that opportunity.
I've been here beginning, so it was the end of 03, the very beginning of 04. Very simply, if it wasn't for Iris herself, I wouldn't be here anymore. I would have died. There's no question about that. She was basically responsible for finding my cancer and getting me to the people that we figured out it actually was cancerous, what I had, and the treatments and finding me doctors and the whole steps. And, if it wasn't for her leadership in my care, there's no question I probably wouldn't be here. And so this place alone is very near and dear to me, and she's very near and dear to me.
I was working that night at 9/11, and I came home and responded as a volunteer firefighter in my community. We were detailed to the Jersey side of Liberty State Park, and we were there when the actual buildings collapsed, and we were covered with dust and debris from the second plane. We did what we had to do and went home. Several years later, last year, as a matter of fact, I became ill, went to the hospital. I was diagnosed with having lymphoma. I was under treatment at Hackensack University Medical Center and never even thought about 9/11 until I was going through chemo treatment, and my wife brought me the paper up, and I read an article in the paper that the study was done at Mount Sinai that my age group and my type of lymphoma that I have has been discovered at 9/11. I showed the doctor the article, my Dr. Guar, who's in charge of the cancer center, and he said it's very possible, and he was able to hook me up to people down here, and after I was done with my chemo, for that section I came down for my first exam. I think it's very important that they have something like that. And